Hello, everyone, and welcome to the fifth episode of Empower Her Voices series. This podcast is meant to actually share insights, perspective, and stories which revolve around empowering and educating women and young girls. And we are really glad and honored to have our esteemed guest, Dr. Deepak Puri, for today's episode, which is going to be about understanding the myths, importance, and different other important information regarding heart health. And Dr. Puri is the Senior Director of Cardiovascular and Thoracic Surgery at Max Super Specialty Hospital. He is an expert in complex cardiac and thoracic surgeries. Dr. Puri is also a renowned international academic leader in clinical research, and he's a global chairman at Cardiomersion as well, which is a global trust. So we would like to welcome Dr. Puri that he took time out from his busy schedule, and today he's going to educate us about the heart health.
Good morning,
Welcome.
everyone.
Thank you, Dr. Puri. Well, thank you so much for accepting the invitation. It's really kind of you. And we're really excited for today's episode because it's really, really, really important, and nothing's more important than health. So, before that, we are going to start. I would really like you to walk us through your journey of where you are till now. So, we would like to know it from your side, sir.
Thank you so much, Fyza, for inviting me. So, I'll briefly tell you about myself that I belong to Shimla, which was the capital of India in British regimes during summer, sorry. And also, after doing my medical school from Shimla, I came to Chandigarh, which is a very beautiful city in the north of India, and I did my MS in surgery from there, and thereafter I did my MCH in cardiovascular and thoracic surgery. And later on, I joined as assistant professor in the faculty of PGIMER, which is a very prestigious institution in India, and it is well known abroad also. Thereafter, when the corporate sector came up, so there was a lot of advancement in the management of cardiovascular diseases in the corporate sector. So I joined Fortis Hospital Mohali, which was the first Fortis hospital, and they have a chain of more than 80 hospitals all over India. I worked there for around 13 years, and after that, then I joined as a senior director in Max Hospital Mohali, where I'm working right now. So I had a good fortune of visiting some prestigious institutions in US, like the University of Maryland in Baltimore, and the Swedish Hospital in Seattle, Washington, and also the Leipzig Heart Center in Germany, which is a very one of the largest centers of cardiovascular diseases management in Europe. And apart from that, I had the good pleasure of visiting Lahore. And that was in 2006 when there was a heart summit, and I was invited to give two talks and two chair sessions. And
Great.
I'm very thankful to the hospitality that was offered. I still remember. And recently also participated online in one of the heart failure conferences that was organized in Pakistan. And Dr. Shahbaz, like he's one person who is in close contact with me, and we interact with each other for academic events.
Great. So
So this
it's
is briefly
really
about my journey. I'll like to add another thing that after working day and night for managing, I'm basically a surgeon, so we do a lot of cardiac surgeries, and the main cardiac surgery that we do is bypass surgery, CABG, and we do it off pump. Since last 20 years, we have been doing all the surgeries off pump, and we realize that however number of surgeries we do, but still we cannot control cardiovascular diseases, because now this Indian subcontinent has become the leading harboring heart failure and heart disease patients almost 60% of the world's population of heart patients, they reside in Indian subcontinent. So we realized this, and we thought that 80% of the heart disease, they are preventable. So people are not taking appropriate steps because of lack of awareness about how to prevent heart disease and how to manage. Like, people don't know when to go immediately to the hospital after a heart attack. They waste time, and then the heart muscle is damaged, and they later on become heart failure patients. So, to educate people about the prevention as well as the interventions and the latest development in technology, like new technologies are coming every few years. So, we keep updating people around the globe, and we organize workshops and conferences across the globe to make people aware. And especially we focus on the youngsters, because uh, in India, young people are dying because of heart attacks suddenly, especially after COVID. So I'm not really aware of what is the situation in Pakistan, but I'm sure that genetically we have the highest risk among all races, which
True.
is almost 20 times more than the Japanese, and 6 times more than Chinese, and 4 times more than Americans. So we
Oh.
must take care and protect our hearts.
Absolutely, Dr. Deepak, thank you so much. Your journey is truly inspiring, and the way you have actually given the, shared the importance of what heart disease and heart health is. And the numbers are quite surprising. Like, you've said that more than 60% is from this continent.
Yes.
Oh my God, that's like really
50%
alarming.
of the entire world's heart patient population is from this
Oh.
subcontinent.
So, then it's this episode is actually the need of the hour, and many more such episodes like this. And we are grateful that we have professionals and like you, who can actually educate us, and through which we can actually make some difference. So, sir, talking about same thing, heart health is often like misunderstood, and there are a couple of like misconceptions regarding this. So how should how you have actually encountered this, and how a woman can be educated that she should know the difference between a fact when it comes to heart health as compared to a myth or misconception?
And this is very important to understand that there is a myth which is prevailing since long time, that women, they are less affected than men when it comes to heart disease. So actually this is not true, because the data from even US, it is shown that 50,000 more women die because of heart disease every year compared to men. But in this region, I think the figures may be much worse. And the various reasons for this are that in women, they don't have typical symptoms, because in men they have typical chest pain in most of the cases. But in women, the typical chest pain is not there, and women usually present with other vague kind of symptoms, like maybe excess fatigue, or maybe they are having some dizziness, or they are having, like, they're not feeling well, and they may be having pain in the jaw, or maybe headache, or they are not able to do their routine works. And some people, like even doctors, they misunderstand it for some hormonal problem, or maybe they refer to a psychiatrist thinking that the patient is having some depression and anxiety. So if we compare the heart disease in women to that in men, the differences are that although the risk factors are similar, but the risk of having a fatal heart attack or a stroke, which could be debilitating or even fatal, they are more in women compared to men. Like, if we compare the risk factors, like smoking, if the woman is a smoker, then the risk of her having a heart attack or a stroke, they are much much more compared to the men. If we compare about obesity, the risk of women having heart attack who after obesity is much more compared to men. And similarly, the risk of like diabetes, like once a woman has diabetes, her risk of getting a heart attack is maybe 4 to 7 times more, while the risk of a man having a diabetes, and the risk factor will be 2 to 3 times more. So when we compare the common risk factors, they are much more severe in women. Plus uh, the incidence of not getting diagnosed as a heart disease is more in women, because 50% of the women, they present for the first time in emergency with a heart attack itself. They have no prior diagnosed incidence of coronary disease, and suddenly they will present with a heart attack. And also it has been seen that those women who are smoking and taking oral anticoagulation, like oral contraceptive pills, like they are also at a much more higher risk to heart attacks and stroke. And if you compare in different age groups, the younger women, they have different kind of heart disease. Like rheumatic heart disease is more common, which damages the valves in young females. And then, like in pregnancy, they may have a pregnancy induced hypertension, like the blood pressure rising during the pregnancy. And they may be having diabetes mellitus, which is precipitated during pregnancy. So the blood sugar levels, they start rising, and those patients who have high blood pressure, they are more risk of having eclampsia, which is a severe complication of pregnancy. And those women who have rise in the blood pressure during pregnancy, they are more at risk of getting hypertensive later on also, after maybe 10 years or 15 years. And also women, they have more risk of stroke after pregnancy, and they have more risk of their arteries getting dissected, like their artery getting torn after delivery. So the risk is higher in women. Apart from that, there are other kind of diseases which are particularly more common to women, uh, like the microvascular angina. In this, the main arteries, when you do a angiogram, the artery will be normal, but the woman is having angina, like the blood flow to the heart muscle is less, because the small branches of the main arteries, they are narrower. And also women are more likely to have what the Japanese have labeled it as a Takasubo cardiomyopathy. What happens in this is that because of some emotional trauma, like what we call the heartbreak syndrome. So women more commonly have it, where the function of the heart is deranged. But when you do the routine investigation and the angiogram, the coronary arteries, they are normal. The arteries supplying blood to the muscles, they may be normal, but they are having dysfunction where the pumping of the heart is affected. And fortunately, this is a treatable disease, and within few weeks or few months, the patient, with some emotional support and few very little medication, the patient will fully recover. And apart from that, like the severity of heart failure is also more in women.
Oh,
And if we compare in the post-menopausal phase, like women who have early menopause, or some women who have their ovaries removed because of some disease, so the estrogen hormone is withdrawn, and after that, the risk of getting blockages in the arteries which cause heart attack, it steeply increases, especially in those women who have menopause before the age of 40. And in the elderly age group, the chances of having heart attack, it increases more faster compared to men, but they don't have typical symptoms. So most of the times they get like some different kind of treatments, but the disease is not diagnosed. And also it is seen that in women, even if the disease is diagnosed, the chances of women coming forward for the treatment, they are less compared to men, because always women are so busy in their household chores, with their family, with their, some, most of the women nowadays they work also, so they keep on postponing the treatment. No, okay, sometimes they say that the kids have their exams, sometimes there's some important thing going on in the family, so they don't prioritize their own health, and yeah, most of the time they are neglecting it. Plus, because the women have more chances of getting obesity, they have more chances of getting diabetes, and their vessels are smaller compared to men. So
Okay.
all these factors, they complicate the heart disease more. So the outcome of, even if the women come forward for treatment, the outcome is not as good compared to men. But still, if they get treatment, so the outcome should be good only. So the, what I want to emphasize is that women should be aware about all these things, and they should take care of their health and come forward for prevention as well as the management, and not wait for the complications, like if you get a heart attack or stroke and then only you come to the hospital. If you wait, then the outcome will be much worse, and if you take preventive measures, then the outcome will be much better.
Great. Thank you so much, Dr. Puri. I'm sure even when you were telling all this, so I was just kind of, matching it with the information that I have. And there's a lot that I've just learned. I didn't know about this, to be honest. And you have shared the facts exactly, the percentages, which is going to be very useful for the women and young girls out there to understand the severity of the situation, why they need to actually prioritize their heart health, which is really important. And I totally agree with you that women, most of the time when it comes to their health, they tend to ignore, like most of them. And you have actually spotted the real, reason, that either they'll be busy with their kids and home and work. So we really need to prioritize, and coming towards the prioritization, so by keeping in view this entire, kind of circle which is meant, which a woman has created, or it's there in terms of family and office and kids and relatives. So what are the key things that a woman needs to do in order to prioritize her health? Specifically, if we talk about the diet, the food that she is taking, is it going to affect? If yes, like what's the percentage of that? So how she's supposed to prioritize her heart health?
So first of all, I would like to emphasize that we have to start taking of care of our heart health right from the childhood. We don't have to wait till we become adults and we become elderly. So because the blockages in the artery, it is dependent on few risk factors. Some of them, they are not modifiable, like the hereditary risk factors. So if our parents are affected, then genetically we are at more risk. Then some races are at more risk, like I told you that Indians, they are at more risk compared to the Western population. And also, it is seen that as we grow older, the risk of getting heart disease, they are increasing. And also the gender difference, like some diseases, they are more common in females. So we have to be aware about that, and we have to take care of that. So what we can do is that, because we cannot modify the unmodifiable risk factors, so we should take care of the modifiable risk factors. So we'll talk about the modifiable risk factors, and one by one I'll tell you about it, like you told about the diet. So we must be aware that the guidelines say that we must take at least 5 to 6 servings of fruits and green vegetables every day. So most of the people, they are not taking fruits and green vegetables. So what they are taking more is fried food. So the fat intake is more. So we must know that the fat is bad. It is going to deposit in the wall of the blood vessels. So the recommendation is that your daily intake of oils should not be more than 10 ml. Like 1 teaspoon is 5 ml.
Oh,
So
okay.
in a day, it should not exceed, for all the cooking and whatever you do, should not exceed 10 ml in a day for one person. So you
Right.
can easily calculate your oil consumption by the amount of oil you purchase every month. So
Oh.
if you are purchasing, say if you are having 3 people in your family, so 30 ml per day means 900 ml per month. So if
Yes.
your oil consumption is more than that, if your oil consumption is say 1 liter or more than 1 liter, like 2 liters, that means you are consuming more than 2 times the recommended oil you should be consuming.
Oh
Plus,
God.
we should not take saturated fats like ghee and butter. So they are bad for the health. And the trans fats are very bad. The trans fat is like in when you see that in the market, like they put oil and all day they are heating the oil and keep on frying various things. Like in India, they fry the pakoras and samosas. So these are having very high quantity of trans fat. So this is very harmful. It can even cause heart attacks. It can cause cancers in the body. So that is totally avoidable. Apart from that, like we should restrict our salt intake to less than 1 spoon in a day for the entire cooking and entire whatever like extra things we snacks we take. So 5 gram is the limit for normal person, and if you are having high blood pressure, then it should be maybe less than 3 gram. And sugar also, you should not take more than 1 teaspoon in a day, entire day. So
Oh.
5 gram is the limit for sugar also. So if we take care of all these things,
Hmm.
then the chances of getting heart attacks will be less. And in women especially, you have to take care that like some women they have hypothyroidism in this sub Himalayan region. So
True.
and they have a tendency of gaining weight. So we should be aware whether we have hypothyroidism or not. And
Hmm.
also like women after pregnancy, like there is a increase in the weight, say 20% increase in weight occurs during pregnancy. But
True.
after pregnancy, and if you are lactating your child, then this weight should come back to normal. And those women who have high weight after say 1 year, so they are the women who are more likely to get heart disease, high blood pressure, diabetes later on their life, and obesity. So we should make sure that after pregnancy, your weight should come back to normal within 1 year. And also, like obesity is nowadays becoming a one of the important risk factor. Like first of all, smoking is the number one preventable cause of death nowadays, and number two is obesity. So we people in this region have a different kind of obesity, what is known as apple shaped obesity. So here the overall body may be okay, but we have more fat deposited in the abdomen. So this
Yes.
is known as apple shape. So in the Western population, they have the pear shaped, where there's more fat in the thighs, in the buttocks, in the shoulders. So their risk of getting heart diseases is less compared to the people who have apple shaped obesity. So the cutoff limit for the Indian subcontinent, it is and even the Asians, it is much less. So if we talk about the BMI, body mass index, which is your weight per square meter of your height. So for Western population, the cutoff is 30. So above 30 is obesity. So 25 to 30 is overweight, and below 25 is normal till 18. But for Indian population and Asian population, and I think this includes Pakistan also, the cutoff limit is much lower. So from 18 to 22, it is normal. From 22 to 24.9, it is overweight, and above 25 is obesity. So everybody should know your few figures, like what is your resting pulse rate, your blood pressure, and your like waist circumference, which is very important. So waist circumference is not the size of waist in a jeans or in a trouser you wear, but it is the waist circumference at the level of the umbilicus, like the navel. So
Right.
your waist circumference should be half of your height. So
Hmm.
suppose, what is your height? I'm asking Feza, what is your height?
It's 5'5".
5'5".
Yeah.
So how much should be your waist circumference?
5'5" means half. I'm bad in numbers. So we
It
have
is
to actually count half
height.
of, okay, half of the height. It's like then 2.75.
Five is 65 inches. So
Okay.
half of that means that your waist should be less than
Two
32.
65 and 32. Yeah. Okay. So this is like the calculation for everyone. Anyone
For
can do it.
everyone. So it
Okay.
should
Okay.
be
Okay.
less than half of your height. So
Oh,
everyone should calculate your waist circumference, and if it is more than half of your height,
hmm.
then you are apple shaped obesity, and then you have to reduce your waist. So
Oh.
this is one of the most accurate indicator of risk factor for heart disease in future.
Okay, okay, that's really an eye-opener conversation because most of the things that you have told us about the food intake, I am sure majority of the people are doing opposite to it. Even
Opposite,
you have
opposite.
mentioned,
And
unfortunately, it's like, we really need to, I guess, then we all are at the risk of, this disease, God forbid.
that's why we are affected at least around 15 years earlier than the western part. So in this region, like, we get affected much more earlier than the western population.
And that's primarily because of the food intake, what I can like process right now from your conversation, because we like people from India and Pakistan and other like related nations, we are like more into these fried food
Right.
and these
Yes.
samosas and pakoras and things like that. So we really need to look after this. And I'm sure the people who are going to listen to this, they, especially the women and the people who are in charge of the kitchen, they really need to look after what exactly we are getting inside us, because then it's coming outside in form of heart attack and God forbid these
Yes.
diseases.
And
So
another important thing is that uh, the breakfast should be the best meal. But most of the
yeah,
people, like especially women, they skip their breakfast or they take it
true,
too late.
true.
And the lunch should be less than the breakfast, and the dinner should be the lightest.
And it's
So,
opposite.
uh, so if we want to have a V-shaped figure,
Hmm.
so the shoulders should be broader and your waist should be narrowest.
Yes,
So,
yes.
so if you take breakfast as the heaviest, you will have broad shoulders, and
Oh,
if you take dinner as the lightest, you will have narrow waist. So narrow
hmm.
waist is considered very healthy. So you must have heard a lot of songs which are based on the waist.
Yeah, yeah,
So
exactly, exactly. So
they
there's this
appreciate
medical relation with this bit. That's what you're
relation. This actually,
saying.
the narrow waist is considered to be uh, significant of a more healthy individual.
Okay, that's something really important, and I'm sure that every woman would like to have it because of the health
Yes.
and overall fitness as well. That's great. Thank you,
Next,
Dr.
we
Puri.
come to the physical activity. So,
Oh yes, exactly.
most of the women, they are not doing adequate physical activity. So, the guideline is that every day we should, for a normal person, 30 minutes of brisk walk is
Okay,
essential, at least
right.
5 days a week. So, 150 minutes of brisk walk in a week is
Oh,
very essential for everyone. And for if somebody has a high blood pressure or a heart disease, then the recommendation is that at least 40 minutes of brisk walk all the
hmm.
days of the week should be done. So some
Okay.
people, they are doing jogging, or they may be doing some swimming, or
Hmm.
some like moderate intensity exercises.
Yeah.
So they can do it 25 minutes thrice a week.
Okay.
And those people who are doing like weightlifting or other such kind of activities, so these activities can be done twice a week only. So there's
Oh,
no need of doing excess. So
excess.
one thing I want to emphasize is that most of the women, they do less activity. And when we talk to women, I don't know about Pakistan, but in India, if we tell a woman to walk, she will say no, we do a lot of walking in the house, and we do cooking, and we do household work. So that is not brisk walk.
Uh-huh.
So
That is
you
not.
have to spare half an hour to do a brisk walk, so that you get breathless enough that you can't speak with the person who is walking with you. And you should slowly build up the pace,
Okay.
reach a plateau, and then slowly cool down. Like suddenly increasing your speed is also bad, and suddenly stopping is also not good. You
So,
should warm up, maintain, and then cool down. And also, like those who go to the gym nowadays, I don't know, do girls go to the gym in Pakistan?
yes, yes.
Yeah,
The
because in
most.
yeah, they are very fond of going to the gym in India. So there
Mm,
is a group of youngsters who are not doing any physical activity at all, and there's another group who are doing excess. So they are also at risk. We see like in the news that a person was going to the gym for 2 hours and suddenly he collapsed.
exactly.
So what is happening is that you should know how much is your limit. So because most of the gyms, they don't screen you for the risk
Mm,
of having heart disease. So if you are having a genetic risk, or if you have any acquired risk, then you should set your limit lower down. So they while on the treadmill, so you see
mm.
the pulse rate, heart rate
Yes,
comes. So
true.
do you know what is the limit? Like how much heart rate you should stop?
I'm not sure about this.
Not sure. So I'll tell you that there's a formula 220 minus age. So
Okay.
suppose your age is 20. So
Right.
20 minus age is 200. So
Oh,
200 is the maximum achievable, but you don't have
okay.
to reach up to 200. So if you are just doing normal gymming to remain fit,
Mm-hmm.
60% of maximum achievable is good enough for you. So 60% means 120.
120,
So,
yes.
so once your heart rate reaches 120, there's no need to push further. Suppose you
Mm,
are planning to reduce weight, you are having obesity, or you are like want to become more fit, then you can extend it up to 70%, means 140.
okay.
So
Right.
to go beyond 140, only those who are regular athletes, or they are going to participate in some tournaments, so for them you can go maximum up to 80%. So that is
Okay.
160. So
Right.
once you cross 80%, then you enter the danger zone. So you must remember that the relationship of exercise to heart risk is U-shaped. U-shaped means if you're not doing any exercise, your risk is highest.
Right.
If you start doing exercise, your risk will come down, 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 and then you reach a plateau. So if you continue to do exercise, your risk will be down, but it will remain static. But if you exceed the limit, then your
Hmm.
risk will again start increasing, because
Hmm.
the risk of having fatal events, they increase when you do more than your limit. So your artery can crack, clot formation can occur, and you can have a heart attack. Or sometimes the rhythm problem can occur. Like some people, they may have arrhythmia after excessive exercise.
Hmm.
And in winters, we should be especially careful, because we should not go for walk or exercise early morning. So once the
Yes.
sun is up uh, and the day warms up, then you can go for the walk. And you should not go late evening also, because most of the cardiac events, they occur during the winters. In the entire world, maximum heart attack deaths, they occur in the winters. So if somebody goes for a walk early in the morning when there's a strong cold breeze, so if you do aggressive exercise, it can precipitate heart attack. So it may be because of you may not be having the fat deposit atherosclerosis in your vessel wall, but the artery can go into spasm. Like the artery can become suddenly tight. So in
Okay.
women, the incidence of other kind of like even with a normal artery, the
Mm.
coronary spasm can precipitate a heart attack.
Okay, that's really important. Otherwise, women or girls who are planning for a walk or gym, mostly they do it early morning or late evening. So now, as you have, told us that during winters,
Hmm.
it's like
Hmm.
high probability if you're going to do this. This is something very useful, and this is new as well. So you have shared really important health tips. So
Yeah.
for all the women and girls out there, this episode is, consider it as a treasure trove for you, because Dr. Puri has actually shared everything starting from your intake to your exercise, and then he has shared those formulas, those simple formulas which all of us can do in order to check either we are on the right track when it comes to heart health or not. So, Dr. Puri,
There are
doctor,
many more
talking about,
things I would like to
yeah,
add.
sure, sure.
So I'm not done with the preventive measures. So
Yeah, yeah, please,
another
please
thing
carry on.
is that women who smoke, the risk
Hmm.
of having heart attack is much much more, and
Hmm.
risk of having cancers is also more. Breast cancer risk also increases a
Hmm.
lot in
Yes.
smokers. So women should not smoke, and when we are
Hmm.
smoking, we exhale the bad air out, and other people who are non-smokers they inhale it. So you are increasing the risk of people in your surrounding also. So
Surrounding it.
smoking is usually nowadays banned in public places. So is it
Yes.
banned in Pakistan?
In public places?
Yeah, smoking.
Uh, no, not in public places. In restaurants, yes. When we are saying public places, in open parks, it's not, but in restaurants, yes, it's banned. In cinemas, it's banned. All indoor places, those are
Indoor.
public.
Okay.
It's banned. And in government territory, for example, if we are visiting the historical places or
Okay.
any place which is under the territory of a government in terms of the management, yes, it is banned, and in all
So,
educational institutions, and when it comes to offices inside the office. But when you have to go outside, people do smoke.
okay. So, like in
Yeah.
railway station, bus stops, is it banned
Not yet.
in the markets?
Not yet.
So, I think you should emphasize that because women they may not be smoking, but they are inhaling the smoke which the other people are exhaling. So we
Right.
should emphasize this. And regarding alcohol, like the limit, usually the guidelines say that those who don't take alcohol, there is no indication to start taking. Like some people say that it is good for the heart and wine should be taken. So
Mhm.
it's actually a myth because
Okay.
there's no medical indication to start drinking to take care of your heart. But those who take alcohol, the
Hmm.
limit for women is much lower. Like they should not take more than one drink in a day. So some people they don't drink for a month, and then one day they take like 8 10 drinks, which is called binge drinking, and that is bad for the health. So it will harm your liver also, and it is bad. It can cause heart failure also. It can cause arrhythmia also, especially in the winters. So many people they take a drink that they think that it will give them protection during winters, but then when you drink, it can dilate your arteries, and
Okay.
it can cause some cardiac complications also.
All
So
right.
drinking also, those who drink they should take in moderation only. For women, the tolerable level is half of that of men. And
Okay. Okay.
other things like vitamin D exposure. So many women nowadays, if they are working and doing household work, their exposure to sunlight is very less. So
Hmm.
now,
True.
like previously, people used to think that vitamin D is required only for the bones, but
Hmm.
nowadays there is enough evidence which suggests that if your vitamin D levels are low, then the chances of getting heart attack are more. And it is seen that the precursor of vitamin D is squalene. So when you are exposed to sunlight, it gets converted into vitamin D. But when you are not exposed to sunlight, it gets converted into cholesterol. So if you're not exposed to sunlight, your cholesterol levels will increase and your protection against heart attack will decrease. So the chances
Okay.
of getting a fatal heart attack is more if you are having vitamin D deficiency. So every woman should check their vitamin D levels and correct
Okay.
it, because otherwise the chances of osteoporosis are also more, and the bone getting fractured by small
Mm.
injuries is more, and also the chances of heart attack is also more. Apart
Okay.
from
That's
that, stress is nowadays becoming very important. Many people, they are not able to have stable relationships nowadays. Relationships are becoming more fragile, so more and
true.
more evidence is coming, and especially it is seen that almost one third of youngsters, they are having significant stress. It may be related to their studies, maybe to their careers, it may be financial, it may be because of the bad relationships. So it is very important to maintain healthy relation with your family, with your friends, with your colleagues, with your seniors. So those people who are not able to maintain healthy relationships, they are more prone to get heart attacks and stroke and diabetes and hypertension and other lifestyle diseases like cancers. So this is also very important.
So yes, I was actually about to ask it, but you have highlighted it like very well about the importance of this mental and emotional well-being, that we really need to look after this as well, because along with the physical aspect, which is linked to heart health prioritization, we really need to, as Dr. Saab has said, that we need to keep a focus on how mentally stable we are or what we are up to in terms of our priorities or relationships. So it was really, really insightful, Dr. Puri. You have actually cleared couple of misunderstandings and myth which was regarding heart health, and specifically I just got to know because you mentioned that D3, vitamin D3 is something people link it to bone health, and yes, I was also of the same opinion, but now you have actually educated us that no, it has a lot to do with your heart health as well. And I'm sure for all the girls and women out there, you really need to actually, what you can do is that you can actually take the notes of Dr. Puri's different aspects that he has shared, because he has elaborated in a way that I'm sure even if you're going to go to a hospital, none of the doctor is going to tell you in this much detail that you have to do this. And we are grateful to you, Dr. Puri, that this is, that's why I've said that this episode is a treasure trove. I would rather call it as a treasure trove of heart health and information. So we just want, if you can just kind of wrap up advice or a wrap up kind of information that is going to be a summary for whatever you have just told us, and anything that you want us as women or girls to start doing it from day one, because you said it cannot be like we can do it everything at once. We need to prioritize and step by step, and then excessive need of anything is also not required. So we want you to give us the overall wrap up insight of this heart health information.
Sure, I would like to summarize that it is a myth that women are less affected by heart disease. Rather, they are having more complication, and the chances of getting not diagnosed properly and landing up with a heart attack are much, much more in women. And also, the risk of stroke is also much more in women. And the chances of not getting appropriate treatment are also more, and also the chances of neglecting in spite of getting diagnosed is also more in women. So I would like to give you a brief advice that it is never too early to start taking precautions. Like, as soon as the child becomes aware about other things, it should be in the curriculum. There should be some chapters which emphasize how to take care of your health, especially your heart health, because we only have one heart. We have two lungs, we have two kidneys, two eyes, but heart is only one. So once it goes wrong, then life is totally deranged. So best thing is that once a person becomes aware, like a child, So if we prevent at that time, it is known as primordial prevention. And once the risk factors start coming, like in teenage, somebody may start smoking, somebody may become obese, somebody may be having stress. So all these one by one risk factors, they creep in. So if we take control at that time, it is known as primary prevention. And later on, like sometimes the person starts having symptoms. Nowadays, even young girls in their 20s, they come to us with symptoms. So at that time, if we diagnose early, then some unconventional methods and lifestyle control can control, like you do yoga, you do music therapy, and you adopt a healthy hobby in which at least you spend half an hour to de-stress yourself, whatever you like. Our brain has two hemispheres, one is right and one is left. So for a right-handed person, the left is more active, like it is doing the all the skills that we acquire in our life, whatever knowledge we acquire. So the left hemisphere is active for that, and the right hemisphere, it is for the passions, like somebody likes singing, somebody likes painting, somebody likes some other activity. So most of the people, it is nowadays seen that they use only one hemisphere and the other hemisphere is neglected. So that is very dangerous. So it can cause so many lifestyle diseases. So
Right.
once you start doing this, then you can control the further progression of the disease. So we have made some performers which are available on our Cardiomersion website also. And if required, like I can send you the QR codes for those.
Yes,
You can
sure.
share with your group. So
Sure.
if you fill that performa, then you will come to know about what risk factors you have in your life. And
Okay.
once you come to know about your own risk factors, you can control them, because most of the people, they are not aware about their own risk factors, and
Mm,
that's why they are not able to control. So once you control your risk factors, the progression of the disease can be slowed down, or you can even make it stop at that level. But sometimes, even despite all these, somebody can land up in the complications. So then what to be done? Like suppose one has a heart attack, what to do? है ना? The first hour is the golden hour. So you should immediately rush to the place where there is a cardiac facility. But if the cardiac facility is too far, what you can do is uh, they give some injection uh, by which they can thrombolize, like the clot can be dissolved. So it will give some additional hours or additional days for you to be stabilized and then sent to the far off cardiac center. So it will not cure the disease, but it will give you extra
okay.
time and it will stabilize a person. Otherwise, what happens that if people are referred to us with the heart attack, and if the artery is blocked and if the journey is too long, the patient can die on the way. So first we have to know that if the cardiac center is too far, best is to thrombolize, stabilize, and then send. If it is
Yes.
nearby, you can reach within 1 hour. This is the golden hour. You can directly rush to the center. And many people, they think that whenever they have a heart attack symptoms, so typically you may not have the typical pain. So any discomfort above the level of your navel, you should first rule out heart disease. And many people, they treat as gas problem and take antacid. So last year I was coming in a flight from Tokyo, and a passenger, he had discomfort, and he was given some medicine, antacids, and he crashed. So then we had to do the
Okay.
resuscitation and revive the patient. So we were on sea, and I told them we have to land somewhere because he had a cardiac arrest, and we did a CPR. Because if you don't do a CPR within 3 to 5 minutes, the person will be brain dead. So then they told that you can divert the flight to China, so which was 3 hours away. But I was not sure whether we'll be able to get the medical facility in China immediately. So I told them, can we go to India somewhere? So they diverted the flight to Calcutta. So it was 5 hours away. So 5 hours we were trying to resuscitate the person. And when we reached, the ambulance was kept ready and we rushed to the hospital. Artery got blocked, and artery which was blocked was opened up. So
Okay.
patient survived. So this can happen anywhere,
Hmm.
anytime. So you
Yeah.
don't have to wait for the typical symptoms. You should rush to the hospital, and then you have to decide which is best for you. Like if
Hmm.
there is a heart attack, then sometimes it can be treated by medicine. Sometimes it needs intervention. So it may need stenting. It may need a bypass surgery if the multiple vessels are blocked and left main is blocked. So you may need a bypass surgery also. So whatever is best, it is decided by the team. So team
Hmm.
of cardiologists, cardiac surgeon, and the patient, they sit together and they decide what is best. And nowadays we have robotic surgery and other forms of surgeries, non-invasive surgeries also. So we have to decide which is best, because it is not necessary that robotic will be best, because in cardiac you need a lot of precision. So I went to US in 2009 to train in robotic surgery, but the president of the robotic surgery, who himself was doing two surgeries in a day, they also stopped doing after 2 3 years, because the long term results were not supposed to be that good. So they also abandoned doing it. So
Hmm.
it's not necessary that all the technological advances may be good for you. So it is the
Hmm.
person who is going to do it, who decides what to be done. And after the procedure is done, then rehabilitation is very important. So it is seen that most of the women, they don't come forward for the rehabilitation compared to men. Men, they do the proper rehabilitation and go back to work. For women, like, they don't come for the rehabilitation, they think that they will recover themselves. So this is also bad. So because of this, the outcome of the procedure may not be as good as it is in men. And apart from
Okay.
rehabilitation, once you are back to your work, after that also you have to take preventive measures so that the incidence does not occur again. So
Okay.
that is the, we have to prevent it. Secondary or tertiary prevention is also equally important. So women must understand that
Hmm.
they have to take care of their health apart from taking care of their home and their job and their husband, their children. Taking care of their health is also important, and it is much more important. So first priority should be given to their own health, and next to the family and other things like job and all profession. So once they
Great.
start doing it, they'll be able to improve their performance at home also, and they'll be performing better at their jobs also, and
True.
they'll be having a better lifespan and a better health span. Thank you.
That's very, very, very well said, and thank you so much. There's a lot that we need to, process, and then we need to implement what you have told us. And Dr. Deepak has shared a beautiful advice that apart from looking after your family, apart from looking after your kids and husband and work, first you need to look after yourself. So he's like spot on about this thing, because if you are healthy, only then you can, run towards a healthy family. Because if you will be healthy, so will be your kids, your husband, your relatives, and so on. So first priority is your health. And again, thank you so much, Dr. Puri, for taking time out and for such an elaborative session in which you have gone beyond the details to make us feel that okay, fine, this is the way how you can prioritize, this is the way how can you put your health right in front. And we're truly grateful for this. And by
And
the way, you're
apart
the
from this,
first.
there are many, many more things, because 1 hour is a very short time to
We
emphasize
would
on all the
definitely
small
have
points.
to, yeah, we would
So,
love to have you again for another episode as well, because there's a
sure.
lot
And
that we want to know more.
sure, it will be a great pleasure. And I would like to also share that we have got a YouTube channel, Dr. Deepak Puri. So there we keep on posting videos related to heart health and other control of lifestyle diseases. So few videos may be for the doctors, and few videos they are meant for the patients, and few for the general public. So you can choose the video that you would like to watch. And also, like we made a small movie by the name Rakhiye Dil Ka Khayal Dil Se. So
Oh, wow.
this movie, this was nominated for four international film festivals also, in the short film category. So it is emphasizing that why youngsters are getting heart attacks and what should be done to prevent them. So it is not a lecture; it is a kind of a story, and you can watch that. And
So it's there on your YouTube channel?
YouTube, yes. And
It's there.
I was even awarded as a best director for that movie.
Wow.
Uh,
We would love to see that. And in fact, with your consent, I would like to share the link of your YouTube channel
Sure.
while we are going. Can I do that? Because I'm
Yeah,
sure I am also, I'm also going through Dr. Deepak's YouTube channel. It's really informative. And trust me, it's like, more than like even more than an hour, like the episodes are there, the recordings. And there's a lot that Dr. Puri has shared over there. So you can subscribe to his channel, and then you can get the instant updates and everything that has been posted regarding patient or doctor. So, and the movie that he has mentioned, we would love to watch that. And
yes.
obviously, because through movie it's kind of interactive and we connect well with that.
So
That's
this
the thing.
movie, we have made three like editions of this movie. Like one is the complete movie, which was almost 1 hour. So
Okay.
last year it was the 100th anniversary of Indian film star Devanand. I don't know whether you know him or
Yeah,
not.
yeah,
He
yes, we heard about it.
was
He's a legend.
born he was
Yeah.
born in Pakistan, and when like the Prime Minister of India was invited, so he was also like the Prime Minister of Pakistan. He asked the Prime Minister of India that would you like to me to bring something from for you from India? So he said yes, I would like you to bring film star Devanand with you. So
Okay.
went there and he saw the places where he had studied and where he was like living. So he was the one who was having a very healthy lifestyle, and he was working till the age of 89. So he was producing movies, writing stories, and directing the movies and acting in them. So his belief was that once we stop learning and once we stop working, that is the we are inviting old age and we are inviting our death. So he emphasized
Very
that
well
one
said.
should never stop learning and never stop working till your very last day. He used
Great.
to say that he doesn't want to become a patient and paralyzed, and people are taking care of him, nurses are taking care, and he's on the wheelchair. So he said that kind of life is useless.
True,
So
true, true.
he we combined like his 100th anniversary with the problem of having heart attack in young age. So he was supposed to be like people used to call him forever young. So he used
Wow.
to walk so fast, and I met him personally also when I was in Shimla. I was a kid that time. So I saw him shooting there, and he used to interact with people. He was very friendly, and he used to walk so fast. He used to climb uphill. Like people had to run. We had to run with him to
Wow.
match his walking,
Nice, great.
and
Wow.
used to take fruits and vegetables. So we used to wonder how one can survive on fruits and vegetable at that time, because we were not aware about the benefits of fruits and vegetables. So we combined all those things with the actual story, and
Hmm.
things about how to maintain relationships, how to remain happy, how to remain active. Because
Great.
nowadays people they imitate their celebrities, and
Yes.
celebrities, if they are having a bad lifestyle, then they acquire the same bad lifestyle. Some are
Yeah.
into addiction, some are having depression, some committing suicides, and some
Hmm.
are having some criminal activities. So
Yeah.
all this should not be an inspiration to a youngster. So
True.
young girls should also take inspiration from some celebrities who have a very good lifestyle and who practically follow a healthy lifestyle. So
True.
this can help them in transforming their own lives also.
Great, great. And thank you so much, Dr. Puri, again. And as he said, don't stop learning, and don't stop working. That's the best formula to go forward. And thank you so much everyone for doing this, and for we are grateful for having Dr. Deepak Puri with us today for this episode, which was really insightful. And see you again with another episode, and we'll keep on empowering women with renowned leaders and established professionals like Mr. Deepak Puri. And there's a lot that we can learn. And as he said, keep learning and just don't stop with it. So see you again with another episode. Thank you for watching us.
Thank you so much. And during my visit to